Thank you, Mr. Speaker, and thank you so much to the member opposite, who I know with her experience in healthcare certainly understands the issues and challenges that are happening. As someone who has benefited from medical imaging services, I can't stress enough the importance of listening to these serious concerns raised by BC's Radiological Society. These issues that they identify have led to significant backlogs, pushed overburdened medical professionals out of the field, and this has further exacerbated the delay. As radiologists have pointed out recently, delay in medical imaging causes delay in diagnoses, specialist referrals, surgeries, medical treatments, cancer care, and more, end quote. So it's essential that the province collaborate with these professionals to develop specific solutions to address the issues, as such a dire situation is absolutely heart-wrenching and unacceptable. Now, Honourable Speaker, bear in mind that the letter from radiologists came only 1 week after 200 specialist doctors called attention to the crisis in specialty care just in this past September. It's estimated that 1 million patients are waiting to see a specialist in British Columbia. In these doctors' words, I quote, "Our entire healthcare system is crumbling. Not enough is being done to improve specialist patient outcomes or shorten overcrowded wait lists. And if we don't work together to find solutions, specialty care in this province is going to erode even further," end quote. In BC, just 20% of cancer patients are able to see an oncologist for the first consult within the recommended 2 weeks, compared to 75% in Ontario. Some people wait for months. Now, BC does not make publicly available these data, which are shared with BCRS by people working in the system. Our healthcare professionals desperately want to provide care to patients, but they're exhausted and demoralized in every part of BC's healthcare system. And as doctors and specialists are burdened with overhead and operating costs, BC needs an action plan through genuine consultation to relieve the pressure on healthcare workers. Doctors are asking to increase doctor training spaces and reduce barriers for internationally trained physicians and encourage more team collaboration. Mr. Speaker, I'd like to end by saying thank you to the radiologists that helped me, the BC Cancer Clinic on the North Shore, where someone was able to recognize an unusual and hard-to-find image, North Shore Imaging, as well as the radiologists at Lionsgate Hospital who figured out what the heck it was. So, Mr. Speaker, I apologize, I'm going to have to say this before I end, but you can never trick a radiologist because they can always see right through you. Thank you, Mr. Speaker.